Public health authorities cannot get ahead of the spread of the virus where cases have large numbers of contacts they may have been exposed.
Canada is reaching the limits of what test and trace can do. The nation is running 77,000 COVID tests a day on average, but our top doctors say there's little more that can be done to slow the spread unless Canadians double down on their efforts to stay COVID safe.
The numbers are still rising. This is the time to double down on our efforts to stop the spread. Our loved ones, our vulnerable family members, our frontline workers, they're counting on us to do the right thing.
Canada is going through a sharp spike in cases shown in new projections released by Health Canada last week. Public Health is reporting that known hotspots like Toronto and Montreal are going through a resurgence, but there are also new clusters in regions like Saskatchewan, Manitoba, and New Brunswick, places where numbers were previously low. Dr. Theresa Tam says if cases continue to rise, a return to stricter lockdowns is unavoidable.
This will not be easy and will require hard choices between what we need to do and what we would like to do. But the more we can do our part to reduce the spread, the less local health authorities will have to rely on broader measures like business closures to reduce COVID-19 exposures and manage resurgences.
Some heavy-hit regions like Toronto and Montreal have already gone back to stricter lockdowns, but the effect of those measures is limited if private gatherings and social functions continue. Figures for the Thanksgiving long weekend aren't available yet, but Deputy Chief Public Health Officer Dr. Howard New says we already know that private parties have contributed to new COVID clusters that are hard to spot and harder to stop.
What we're seeing is that there's also a very significant proportion of what happens, quote, in private settings, as Dr. Tam mentioned, be it the weddings, private parties, and so on. So how do you deal with that part?
Public Health is underlining that now more than ever, Canadians need to limit their contact with people outside their immediate households. Already, a full third of new COVID cases can't be traced to a patient zero, and it's suspected that private social gatherings may have contributed to that spread. However, testing may be ready to ramp up. Dr. Tam says the Abbott ID Now tests could be on the street and delivering results as early as the end of the week. In Ottawa, Xiaoli Li, City News.